So welcome to this discussion today around healthcare sustainability. I'm joined on the screen by Janet Smith, who is one of our IHSCM Greener Care Special Interest Group members. Janet, would you like to introduce yourself and the trust you work for?
Hi, I'm Janet Smith. I'm head of sustainability for Royal Wolverhampton NHS Trust and also Healthcare NHS Trusts.
What is your involvement and why are you passionate about sustainability?
Well, my involvement is that I am actually, like I said, as head of sustainability, I am tasked to manage and facilitate the implementation of both trust green plan. And I have to say that for the Royal Wolverhampton one, I did write the green plan, and also for Walsall, I had to do a revision to fit within, of course, the greener NHS requirements. Um, the reason why we actually are implementing, or we have our green plan in the first place, is that we all know that the Department of Health did publish in December 2020 the report on the NHS net zero agenda. And following that, the trust also back in 2010 was one of the 10 trusts to actually pilot the carbon management plan, which was basically an effort to look at how feasible it is to reduce the NHS carbon emissions. But at that time it was state centric, so it was states, and we did try to address procurement, but at that time procurement was rather too big and it was a bit vague on what we could do. So as a result of that, the trust has a bit of an experience, Royal Wolverhampton has a bit of an experience in implementing carbon reduction plans. Although it was state-centric, we did manage to reduce about 15% of our emissions. The program ran from 2010 to 2015. And since then, the trust has always then looked at sustainability as part of its strategy in doing its business. And the advent of the 2020 requirement, of course, for a green plan was a welcome, something that is actually welcome in the trust, because we can then align what we're doing with what the NHS is trying to do as well. So that's the background. And of course, the trust is a passionate supporter for sustainability agenda. We do need to reduce our carbon emissions. We need to ensure our financial sustainability and our environmental sustainability as well, to actually deliver sustainable care to the people that we serve.
And how are you implementing your green plan?
One of the things that we actually ensured is that me being the head of sustainability is only me. There's no other person. And I cannot essentially implement a green plan, because a green plan is an organizational plan. It should be implemented by every single member of the organization. So what we did was first establish a governance structure. And the governance structure starts from, of course, the trust board being the head. And then we then have, of course, the trust management committee, and then we have the finance and performance committee. And alongside that, we then have the chief strategic officer, which I actually is my line manager. And me as a head of sustainability then works alongside the sustainability group. The sustainability group, that's why in my intro to myself, I said I manage and facilitate, because that's exactly what I do. The sustainability group is the one who actually implements the green plan. So the sustainability group is actually made up of the departments, what I call emission source. So in charge of emission source, so estates is one of the emission source. So we got estates and facilities attending it. Capital is of course estates development. So estates development is represented. Digital services is there as well to look at digital transformation. We've got, of course, the divisional representations as well from the clinical one. So that team actually implements the green plan. One of the really, I would say, I would advise everyone to have is a clinical lead for sustainability, because I can talk about, non-clinical things. I can talk about travel. I can talk about all sorts of things. But when it comes to clinical, I don't actually see myself an expert on it. So I need an expert who could actually work with the clinical teams, who understand the processes, who understands the service, to make sure that whatever is done at clinical transformation sites is actually aligned with the whole sustainability agenda. So that's one strategy that the trust actually adopted right at the beginning, which works very well. And in terms of what we have done, one thing is that in terms of the strategy. So one strategy, let's talk about, let's say, energy. The trust wants to have one to achieve, of course, energy security is one thing. The other thing is energy efficiency. And the other thing, of course, is carbon emissions reduction. So all of those three, actually, the trust has been addressing. We have a solar farm, which supports, well, provides 6.9% of our energy requirements. We also have our own incinerator and a CHP alongside it, which also provides us 1.4 megawatts as well of energy. And of course, we have the allocations from the grid as well. So we have that mixture of sources that we know actually provides us that security, and at the same time allows us to reduce our carbon emissions. Other things with that, in decarbonizing our estate is one of the strategies as well. So decarbonizing our estate is actually looking at our buildings, looking at what we need to do to make sure that those buildings are actually net zero by 2040, which might not be, which is quite daunting, but hopefully we'll be able to achieve it. So making sure that they are net zero and as well as climate resilience by 2040. So, and what we've been doing is actually ensuring that any refurbishments or any new build takes into account those two areas. One is the net zero, and also that we are making sure they're climate resilient. It's a long way yet. It's a work in process, but we're doing that. So that's estate side of things. We're pursuing new technologies, new things that ensure that we reach that net zero by 2040 in our estates. The other thing, of course, is clinical transformation. Clinical transformation is a huge agenda for the trust, and it's one of the strategies that we have, what we call greening services strategy. So what we are doing at the moment is we're looking and working with different individual departments. So let's say surgical services is doing a lot. They have fully decommissioned their desflurane use. They have reduced the use of volatile anesthetic gases. And also, they are now embarking on reducing on a scheme that will reduce 80% of our wastage on nitrous oxide. And They are also doing a lot of things, from changing a pen that you used to put light on the eyes, examination pen, that was single use. Now they're using reusable. Same way that group and save for robotic surgery has been stopped because they based on the study, they actually found that it is something that is not actually needed.
Mm.
And same thing with moving from virgin printing paper to 100% recyclable papers, and also stopping printing. And personally, myself, even, I haven't printed a single piece of paper since July 2021.
Wow.
So that, which means it's doable. And also, I don't have an office, so I live on a laptop in a sense. So there are things that the clinical team, so moving from ethyl chloride to caustic. We are using reusable theater cups as well. We are greening our waste services by making sure that we have zero landfill. So we have zero landfill. We are reaching, we're delivering 40% recycling rate in all our areas. And in terms of procurement, we have actually, that's the biggest reduction. We have actually reduced our procurement carbon emissions quite hugely. And that's all what the procurement team is doing. That's all to them, credit to them. And of course, with the clinical team, like what I said about clinical transformation, anything that the clinical team is looking at and switching from the usual product that they use to a more sustainable product actually impacts on procurement. And the work of our clinical products evaluation group and our theater products evaluation group is actually key to that. And having passionate team within procurement also helped to that. So we are using remanufactured devices. We are actually recycling and reusing our walking aids and also inhalers. So there's lots and lots of things, and all of this actually is encompassed with the clinical transformation scheme, because clinical transformation actually impacts on everything. It impacts on energy, because we know that one of the schemes that we're currently going to implement is setting back our EHU, AG and AGSS, which is projected to actually save 30% of the energy requirement, energy use in our theaters. So anything that you do within the clinical departments impacts on energy, impacts on water, it impacts on food, it impacts on waste, it impacts on pharmaceuticals, it impacts on water, impacts on catering and food. So all of that, actually, travel and transport, anything that you do within that area impacts on everything. So that's why for the trust, for our challenge, one of the challenges, because I think I've been talking about what we have done, but one of the challenges actually that we have is getting a buy-in from people in the shop floor. So everyone, because like what I said when I started, this is not mine, this is not the sustainability group agenda. It is for everyone. It is everyone's agenda. But as you know, changing people's perspective is the most challenging thing. Changing behaviors, changing practices is different. It's difficult because you need to be able to actually get the message, the right message. That it's like if I am, let's say, a domestic staff working in the ward, if I go and say to her, oh, you need to do things because, it's about the trust sustainability agenda. But if someone asks me that, if I am the domestic, I say, well, I just do my job. I've been told to do my job. So why do I need to do this? And it's about actually making sure that they know what their part in the whole agenda, where they can actually situate themselves, and they can also see that what they do contributes to both the trust, financial sustainability, and environmental sustainability as well.
Did you have, or have you got, resistance to change as one of those challenges that you're trying to overcome? And in order to communicate to your staff the importance of the sustainability agenda, what are some of the best practices that you're doing as a trust that seem to be working and could be adopted by other organisations?
We are actually greening individual services. So what happens then is that we engage with the service itself. We look at together what their service, carbon emissions, actually, how they are. It's looking at what the service is all about, how the back office functions, looking at how they bring the patients in, looking at procurement, every single things that makes up the whole, list of emissions that the NHS actually has identified. Looking at that and saying, in your operation, which are the areas that are actually carbon intensive?
Mm-hmm.
And which process are those? Which part of the service are those? And then looking then at, if this is actually back office function, it's engaging the back office function and making them aware of all the things that, that makes the process carbon intensive. And also but the approach shouldn't be, you're doing that is so bad, it's not about fault finding, but it's about really a process where everyone then is made aware that whatever they do impacts on the whole team, on the whole service, and it impacts on patient, impacts on their own financial sustainability as well, because that's important. And so, for example, our orthotic services, they have a look at their back office function. They realize that, and this is led actually by one of the PAs, that they realize that their purchases is done every day, and they're actually being couriered over every day as well. And he said, well, all these papers and all this packaging comes with this. Is there something that we can do? So they've decided to talk to their main supplier, and it turned out they managed to remove 378 pieces of plastic in the packaging. They've agreed that all those paperwork that usually sealed in a plastic as well is to be sent online. And then they've agreed that orders will be delivered twice a week in a big blue box, where they can then put all the orders without the plastic packaging. And the box is actually reusable, which they hand them back to them and they get a new one with everything. So with that, they've managed to actually reduce, just on the logistics, 76,000 miles.
Wow.
Yeah.
Wow.
In a year. So that's what I mean. I wouldn't know that, but it was the team, the admin team, that identified it. The same way that in orthoptic service, they have realized that actually if they do, and this is the field testing team, so that they realize that if they act for their SEN patients, they actually realized that if they do a face-to-face consultation, so they usually bring them face-to-face, but if they do a pre-consultation to that via video, that they found out that instead of being able in a session, they're able to just take 4 patients, they can take 6, because everything that actually needs to be said during that is already said in the face-to-face. So that made a lot of difference in terms of their waiting list and all those things. So going back into the challenge, and it's always about making it relevant to the person, to the individuals within the team, so that it then becomes a team effort rather than, it's only she's the champion, that should be her job, but it's about that team. So that's why I said it's challenging, because of course each member of the team have their own personalities, have their own agenda, and of course have pressures as well. So it's about working. It's not the whole sustainability is not about target that you can deliver next week, next month, next year. It's actually a process. So it doesn't follow the usual, by end of 6 months you should have 100% of this. It's not about that. It's about actually looking at what the surveys is can do, and the prioritization at their own pace as well.
Mhm. And for organisations that do not have a head of sustainability or a sustainability team, and they have the idea for a green initiative based on how they deliver their services, who could they go to gain support and to make the idea into a reality? From your experience, what's your advice?
Yeah, my advice is actually to look at, because majority of unless I am woefully informed, is majority of the teams, majority of the trust would have a service improvement team, or efficiency team, or quality team. Yeah. So those teams can actually help, because when it comes to, if it is actually a scheme that could improve the quality of the service that's being provided to the patient, then the Q item certainly, and there will be the sustainability element of it would be an element of the project, but it's there. So that means then it's a change of, if it is a change, or is it an additional, or it's technology. It's about identifying what has been saved,
Mhm.
because I think what makes people a bit confused sometimes, about the sustainability, it's not even about carbon reduction. It's about making things better, making things in your business as usual better. That, because you've done it same way with when I mentioned about the robotic surgery, the group and save, just because you've done it all the time, it doesn't mean that you can actually change it. So that project could have been a QI, it could have been a service efficiency scheme. So it's about, what my advice would be is look at the people that are actually has remit on making things better, whether it's service efficiency, whether it's service improvement, service redesign, QI. Go to them and really just talk to them about what you intend to do, because anything that has consequences, like moving from ether chloride to the cold state, involves pharmacy. And of course, and the first thing that you actually need to approach, and this is me, sorry about that, is actually your department head, your group group, sustainability. If you don't, there's no sustainability, is your QI lead within your group. So it's finding the people that are whose remit actually is to make things better. It might be a lean sigma person, practitioner within your area, or it could just be looking at the things in your business case, because people would put in a revenue business case to actually for new service, and would say that, oh, if we add another consultant and this, we will be able to provide more, but then as a consequence of that, then we will be saving on these processes. So that is actually a sustainability element. There's always a sustainability element that you can actually find in all of these things. It isn't sometimes when I actually speak to a different department, they say, oh, we're already doing that. I said, yes, it's not something new. It is actually about consciously looking at the things that you're doing now and making them better. So because any savings on that, whether it's the time of the patient, because they don't have to come in and being poked in the arm for bloods, or they don't have to come in, you're actually saving them the trip and also the hassle of trying to find parking. But at the same time, you're taking the miles out and improving the air quality within your local area, because all those combustion things are not actually, you're not adding to it. So there's more to it than just counting carbon. It's looking at it at a more holistic manner.
It is. And this goes back to the conversation that we had before we started today's recording around the circular ecosystem and the impact that has. So what are your long-term achievements as a trust to achieving your greener plan?
I think we did at the start, the trust did say that, we need to, of course, the long-term plan is to achieve net zero by 2040 on our direct emissions, and 2045 for the indirect emissions. And I did mention earlier that we started implementing our green plan back in 2022. And by 2024, March 2024, we managed to reduce nearly 17,000 tons. So our big ambition is, of course, to reach net zero as the NHS in alignment with the NHS. But our future plans, particularly on the green plan refresh, is to look at, one, continue with energy, looking at more technology that is actually a lot more stable than air source heat pumps and all other things. We know technology is the development of technology is so fast that you blink and something else comes across. But it's about, for us, it's about looking at those technologies, making sure that they are actually the right technology for our site, because these things requires investment, capital investment, and we need to make sure that our investment is targeted investment that will one, contribute to the trust reduction of its carbon emissions. So that's our environmental sustainability side of things, but also it needs to make sure that it stacks up financially, because if the trust is not financially sustainable, then there wouldn't be any trust actually to look at the environmental sustainability side of things. So that's one thing. The other thing, the big push that we're gonna do is actually the greening our services. So the clinical transformation, like what I explained earlier, clinical transformation impacts every single emission source that the trust has. So it impacts, one of our biggest source now is actually pharmaceuticals. So transforming our clinical services would impact on those things. So that's another one. The other thing, of course, is I think not many people would say this, but it's actually staff development.
Mm-hmm.
Staff development, what I mean is making sure that the trust actually takes responsibility in ensuring that our staff are equipped with the skills and the knowledge to actually operate and maintain new technologies. So for clinical services, there's a lot of AI-based new technology now that is coming into the market. We need to take advantage of that, and which means then that we need to equip our staff with the necessary training for that one. So same way with our estates, there's a lot of new technologies coming in as well, but the with that comes the requirement for upscaling our staff as well. So every single thing, every single area that the trust is operating on, we need to look at that, and we need to make sure that we are taking that responsibility to equip our staff, because without doing that, we cannot really expect the staff to deliver what we want them to deliver. So it's a symbiotic relationship. And the thing as well is that it's not only about new things, it's not about new technology, it's not new processes, it's about maintaining as well the legacy things that we already in place. So it is a bit of what I would say fine balance between heading out to new technology because it's new, it's good, but actually, forget about the legacy, because the legacy will be there. It would take a long time for us to actually, transition ourselves into the new ways of working, the technology, etc. So those are the three things that we are actually. One is energy security. Second, clinical transformation, because it impacts on everything. And of course, our staff development. So those are the big things that we have, and hopefully we'll reach there. It would be a challenge, but I have good people behind me, and we have a very good leadership and passionate trust board and trust management team that is fully backing us up into, they're fully into sustainability agenda. They support it, and that actually is one of the biggest advantage that we have, because without the full support of the trust board or leadership structure, we won't be able to implement what we have implemented.
Well, I'm sure you'll achieve those three goals, Janet, definitely. The people in your trust are crucial, as you've just explained. And that's part of the reason for this short course, is to give people the confidence, to provide them with the knowledge around sustainability on a personal and professional nature. So my final question for you today is very much for a personal nature now. So as you are invested in sustainability in your job, what can you do in your personal life, or what are you doing or hope to achieve to have your own impact on the triple planetary crisis?
I think for me, one is that the short course, I just have to say the short course actually is a gift, because we've been trying to find a course that are actually that's um suited or has been pulled together by people who actually knows about, the challenges of healthcare and of social care as well. So that's very good. So for one thing, I would promote it with my team, and that's for sure, because for it would also, of course, allow me to get that benefit from it, because awareness, as we say, is crucial. Personally, I am doing my own bit as well, because one of the things that I said is that I cannot actually ask people to do or support sustainability if I'm not seen as well as supporting it. So I'm buying 100% renewable as well for energy. I like what I said, I don't have an office. Because for me, having an office, people do tell me that, oh, you're entitled to an office because you're, a head. And I said, senior manager, I said, no, I don't need it, because what would that office be then if I'm not, I move a lot, I go into our different sites. That office will be sitting there. It will be heated during winter. So it will have, so there's no need for it. So that's one of the things. And I said I consciously also make sure that I don't print anything, because I can work, seamlessly with just my laptop. I now drive a hybrid car, and I avoid travel as much as I can. And when I go on site, I make sure that all of my face-to-face happens that day, so that I don't need then to travel so much just because I have one meeting here today, one meeting tomorrow, face-to-face, and it's not so. And I do a lot of the meetings anyway on Teams as well. So that's another thing. The other thing as well is food waste. I don't actually, and also being Filipino, we usually do, if you use everything. So if you have also food, leftovers, you transform it into something else, so for you to eat. So there's a lot of things that can be done, and I do shop for clothes in the charity shops. Because one, they're very affordable. Second is that they're actually also reusing. You're getting, instead of them turning up in landfill, you're reusing them. So there are little things that can be done personally to ensure that you're actually making a difference. The other thing I have actually noticed as well is my bank has now a calculator, carbon calculator. Based on my spend, it tells me what my carbon footprint is, which is
Wow.
rather. I just discovered it the other day, and I was
Which
like,
bank
what?
is that, Janet?
It's NatWest.
NatWest. Wow. Oh, well, I'll have to look at
Yeah,
that.
I have that now, and it says, and the other thing as well is I've signed up to an app called Cora, and it is free to NHS staff. And what it does, it gives me actually details of what I have avoided by using public transport, and what I have emitted by using my car. And the good thing about it is that it provides me with points.
Oh, wow.
Yeah, that I can actually exchange into discounted sustainable products. And we're participating as well in a regional car sharing scheme.
Oh, wow. Fabulous.
So which is very good.
You shall have to come and talk to our Greener Care Special Interest Group members about that, Janet.
Yeah.
What I will do, I will leave that there for today. Thank you so much for your time, sharing your expertise and experience. We love having you as part of our Greener Care Special Interest Group and as part of the IHSCM as a member as well. We'll make sure we link some of those resources you mentioned down below, and also explain some of the acronyms that you used as well for those that might not be familiar. But thank you so much for joining us today. Any final words from yourself?
Thank you so much for having me. My final word is just, go out there, make a difference. It is about what we do every day. It is about making a difference in our business as usual.
Fabulous. Thank you, Janet.